Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Nipah virus is in the news again, this time with an outbreak in Kerala, India. Johns Hopkins epidemiologist Emily Gurley returns to the podcast to talk with me about the deadly zoonotic virus, which spreads from bats to humans, and her work investigating Nipah spillover events. We also talk about how lessons from studying Nipah's complex transmission can give us clues to finding and preventing other spillover events and even pandemics. Let's listen. Emily Gurley, thank you so much for coming back on Public Health on Call. Today, we're going to talk about Nipah and your work studying this virus. So can you tell us a little bit about how the virus presents clinically?
Sure. Happy to be here and talk about Nipah. Nipah is a concern in part because of how severe the clinical presentation is. There has been some evidence of asymptomatic or mild infections, but most people who have Nipah develop severe disease, including encephalitis, which is swelling of the brain, brainstem, or severe respiratory symptoms, including difficulty breathing, or both. And the case fatality is very high. In the first recognized outbreak in Malaysia, the case fatality was around 40%. Subsequently, in outbreaks in South Asia, it's been closer to 75%. Although there is some difference between case fatality among patients who are infected from bats, it's a bat-borne virus, and those infected person to person. If you're infected from another Nipah patient, their chances of survival are usually a bit better, usually about 50% survival. But just because you survive doesn't mean you do well. There are a number of severe sequelae that are often permanent that survivors suffer.
You have been studying Nipah for decades, and you've just mentioned two potential forms of transmission, bats and humans. Let's go back and talk about what we know about how people become infected with Nipah. Maybe we can start with the first recorded outbreak. What happened there?
Sure. The first outbreak where Nipah was discovered was an outbreak of encephalitis among pig farmers. And at first, they thought it might be Japanese encephalitis because that's endemic in that area. But none of the interventions for Japanese encephalitis were working. And they realized that at the same time, there was also an outbreak going on the pigs on farms, primarily a respiratory disease. And they discovered a new virus from samples from one of the patients. And to stop the outbreak, they ended up killing all the pigs in commercial farms in Malaysia, which was very effective, but drastic, had a high social and economic impact. And then they went about the task, after it ended, of trying to reconstruct what had happened. How were humans infected? And they figured out quite convincingly that most of the human cases had contact with pigs. They worked on pig farms, and the risk was even higher if you had contact with a sick pig. But then the question became, where did the pigs get it? This is not a known pig virus. And they were able to identify that fruit bats in the area had evidence of this infection as well. And so our best guess is that those fruit bats were feeding near the pens where the pigs were being raised. Pigs were eating some of the dropped fruit. So these bats are a bit messy when they eat. There's some dropped fruit that falls on the ground, and the pigs, aren't very picky when it comes to what they want to eat. So they were eating dropped fruit. That's our best guess. And then because there was such high turnover in those pig farms with new piglets coming in all the time, that the farms were able to maintain an outbreak ongoing in the pig population. And then from there, it affected humans.
So in this first case, there was an intermediary animal, so the pigs. But then you later go on to study many other outbreaks in Bangladesh where there was no intermediary animal. Can you talk a little bit about that?
Yeah, I first started investigating Nipah in 2004 and outbreaks in Bangladesh. And it was quite confusing because all we knew about Nipah was the experience from Malaysia and some cases in Singapore where pigs were involved. And there are some pigs in Bangladesh. It's a predominantly Muslim country, but there are some pigs raised for food, but certainly not at the scale that they were in Malaysia. And there were a couple of small outbreaks in 2001 and 2003 that had been investigated, and they didn't really see any link with large farming. There was no link that they could identify with pigs. And so we were still at the stage of trying to figure out how is this virus being transmitted in Bangladesh. And I remember clearly walking through outbreak areas and thinking about all the possible ways that a fruit bat and a human might come into contact. And we made lists of all those possible exposures. The fruit bats in Bangladesh are the same species as those in Malaysia or in Southeast Asia, but they are similar. They're similar species. They're all Pteropus species. And so we thought, well, probably that's where the virus is here. We had data early on to suggest that that was true. But it took us a few years to figure out through careful epidemiologic studies that humans and bats were sharing food in this environment, in particular date palm sap, which is harvested in a similar way to maple syrup in the US. So people hang a pot in the date palm tree. Bats often drink the sap at night, and then humans drink it fresh in the morning. And that's how humans became infected. That was good to figure out. But we also learned, and this is what makes Nipah scarier from a public health perspective, is that we were also clearly observing person-to-person transmission after those first spillover events. And that had not been described in Malaysia and Singapore. So it took us by surprise at first when we figured it out. But that's one of the reasons why I continue to work on Nipah, because of the pandemic potential there might be.
Right now, Nipah is in the news because there is an outbreak in India. What do we know about that?
There's an outbreak in Kerala. This is the second large-ish outbreak from Kerala, and both of those outbreaks were primarily driven by person-to-person transmission, similar to what we observe in Bangladesh. We don't know how the initial cases were infected from bats. They don't drink date palm sap there, so it's not that. It's something else, but the something else we don't know. One thing this virus has shown us is that it has a lot of tricks. It can infect multiple species. It can be transmitted directly, from bats to humans through shared food, but the mechanism here we don't yet know.
And when you say person-to-person transmission, what exactly are you talking about there?
So patients who are infected with Nipah often shed the virus, particularly in their respiratory secretions. We studied person-to-person transmission in Bangladesh for 14 years or so, and our accumulated evidence shows that people who have very close contact with patients, particularly those that clean respiratory secretions that patients might have, are at highest risk for infection. Most Nipah patients don't infect anyone else. So 90% of Nipah patients that have been reported never infected anyone else, but 10% do. And among that 10% of those will be what we call super spreaders that infect maybe 5 or more people. And so when you see a large outbreak reported, it's usually that rare super spreading event that you've identified, which means a couple of things. It reminds us that infection control is really important for these outbreaks, to try to control outbreaks. But also, if you see a super spreader, that means there were many, many other isolated cases that probably went unnoticed. And it's those that we have to find if we want to really understand how the spillover is happening.
And investigating a spillover event requires a lot of different people, a lot of resources, and a lot of time. And you've been studying this for decades. What can we learn from Nipah that could be applied to preventing or even investigating other viral spillovers?
I think that investigating viral spillovers from that holistic perspective, multidisciplinary perspective. We often refer to it as a One Health approach, where we're thinking about human health, the environment, the health of other species, including wildlife, livestock, other domestic animals. If we use that kind of holistic approach to investigate every human case that we find, that's really how you understand how the spillovers are happening. And sadly, that approach just isn't used very much. Think about SARS-like coronaviruses. How many of those spillover events do we see reported and investigated? Almost none outside of very, very large outbreaks or pandemics. For Nipah, it's the same. There are many places where outbreaks have occurred, like Kerala, but we don't know how the spillovers are happening. So I think what we can learn from Nipah is just that approach, that how important that approach is, and that it takes a long time to figure out these spillovers, because although they're not rare globally, at any given place and time, they are rare. And so you have to keep on it. You've got to, bring together these One Health teams, but keep investigating, keep looking for decades. It has to extend beyond the terms of any one particular grant or any one person's tenure in any given position. It takes a long time to accumulate the evidence to feel confident about how they're happening. So I think that's what we can learn from our experiences, that you need the dedicated time, resources, and you need that holistic approach.
Is there a way using this holistic approach to prevent a spillover from happening before it even infects anyone?
I think so. If you know mechanistically how that virus is getting from the reservoir host into a human, then typically you can think of multiple ways that you could stop that from happening. In the case of Nipah in Bangladesh, we developed and trialed interventions to keep bats out of date palm sap. The interventions work. People typically were happy to use the skirts, we call them skirts, to cover the pot to keep bats out. There are a number of other benefits to using those and keeping bats out. It's not just about Nipah, but it's an agricultural product. Sap collectors want to sell the sap, and if it's spoiled by bat urine or feces, then they also lose out on their profit. So we tried to align interventions with incentive structures that are already there, and to use ideas that came from the people who collect sap to make sure that they are feasible, reasonable things to promote. So I think we have some ideas of how to do that. There isn't as much investment in rolling those interventions out. There are a lot of competing health priorities, but hopefully that can also provide a lesson that if you really understand how transmission's happening, you can come up with ways to interrupt it.
Well, I think Nipah sounds like an excellent case study for showing us just how complicated this research is. And thank you for the time and breaking this down for us.
It's my pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.